are gathered today, and thank you for fighting the fight.
Committee leaders, members of Congress, good morning, and thank you for calling this hearing on Second Amendment rights and our proposal for the Affordable Care Act guns and ammo coverage regulation. My name is Clara Flook, like the fish, only not spelt the same. I am a 23 years old student at the Fashion Institute in New York City. I am also a past president of Fashion Institute Students for Reproductive Ammunition and Reloading Justice. Now, you may be wondering why I, as well as my colleagues who were detained at the entrance to this building, are campaigning for guns and ammo health insurance coverage. Well, I'm here to answer that. In the Constitution, can I say that word? I apologize. I hope I didn't offend anyone on this panel. If I may, I'd like to pass out copies to the members of the panel and the President and Attorney General, just in case anyone is unfamiliar with it. It's true that this Constitution was written a long time ago. It's even older than Twitter. In that Constitution, there's this thing called the Bill of Rights. The second of these rights says, a well-regulated militia being necessary to the security of a free state, the right of the people to keep and bear arms shall not be infringed. It's interesting that health care as a right doesn't appear anywhere in the Constitution, but the right to possess arms does. Go figure. So what we're saying is if health care is a right that other people must pay for, then gun ownership must be too, since it's listed second in the Bill of Rights. I know for many people in this great city, especially in the media, guns and ammo are more difficult to comprehend than the Bill of Rights. They often confuse rifles with shotguns, and their brains freeze when considering the difference between automatic and semi-automatic. And God forbid you should bring up the single action and double action, which many in the media confuse for college lifestyles and contraception. Now, I'm sure you must be asking, how are guns and ammo part of health care? Guns lower health care costs. They prevent unwanted murder and assault. Every day, hundreds of rapes and thousands of other violent crimes are prevented just by showing a gun. 39 states are right-to-carry states, and statistics show that in these states, the crime rate fell or did not rise after the right-to-carry law became active. Guns and ammo also prevent STDs, or socialism-transmitted diseases. For example, gun ownership helps prevent Occupy movement disorder, which turns our public parks into dung heaps and spread disease and violent crime. Gun ownership also helps prevent protester Tourette syndrome, which leads to chants like banks got bailed out, who got sold out, whose money, our money, and whose street, our street. Without this insurance coverage, guns and ammo can cost a person over $2,000 a year when you factor in ammo, maintenance, shooting fees, and ear protection. For a lot of students who, like me, are on public interest scholarships, that's an entire summer salary working as a public employee union protester. 40% of Fashion Institute students report struggling financially as a result of this policy. One told us of how embarrassed and powerless she felt when she was standing at the gun counter learning for the first time that .45 caliber hollow points were not covered in her health care insurance. She had to walk away because she couldn't afford it. Imagine how that felt. Women like her have no choice but to resort to back alley ammo sales. When I look around the Fashion Institute campus, I see the faces of the people affected by this policy. I have heard more and more of their stories, and so I am here to share their voices. As guns and ammo right advocates, we refuse to pick between a quality education and our health. We resent that in the 21st century, people think it's acceptable to ask us to make this choice simply because we are Americans. That is something we can all agree on. Thank you.